Hey, I'm Megan Lynn. We are here with Julie, my beautiful patient here, absolutely stunning. We have already done a few things with her. So we have already top to bottom done some temple fill, touched up the cheeks, just really posterior. She's quite full anterior here, as you can see. We did some nasolabial folds to really smooth that out. And I'd like you to really take note, we did this area down here, that pre-jowl sulcus. So now that we've done that and filled in that gap, she's got a lot more tightness in her skin, which is what she came to me complaining about. Her very first statement was, I need this pulled back, was even seeking out that surgical intervention. So to hold her over, we've filled in this gaps here. We've also done her lips, so she's pretty plump. Our redheads, especially our freckly redheads, are often the ones that will swell. So
yes, keep
that in mind. Next, we are going to be moving to her jawline. We're just going to do this posterior back here. I'm going to sharpen up, especially in the back of the mandible here, and then we're going to come ahead to chin. So for right now, we're just going to start with that back of the mandible. I have her marked out. There's a little line underneath here. I'll probably palpate again. I like to feel the facial artery. I personally can usually palpate it, so whenever I can, I mark it, and that way I'm going to stay away from it. In this case, I'm not using cannula. I'm just going to be doing some direct injections. So I just had to mark off that. I know I can stay away from there and know my anatomy and know my planes, and we'll be right on bone for this procedure. Okay, so for this patient here, I'm just going to turn her. I already have the angle that I'm trying to achieve here kind of laid out and marked. For women, we like a little bit more of an open angle. For men, we would have a nice strong angle. For Julie here, we're going to start right at the corner though. I'm going to go perpendicular, hit bone, give a good strong pull back aspiration. Make sure I don't get anything. And I'm staying directly perpendicular. I'm going to give about a 0.1 cc pull it, or 0.01. Never giving more than a tenth at a time. What did I just say? 0.1? 1/10 of a cc at a time. We're going to follow along her jawline, aspirating with each one. And I'm really just watching till I see what I like. There's no real exact science. Every patient's going to be a little bit different. You'll give more or less depending on the patient. And I'm just trying to sharpen up this angle. So these are all directly on bone. One tip I like to use is to blot. You absolutely can use plain cotton swabs, but I love using Q-tips because it just gives that direct pressure and helps keep it a little cleaner. All right, so we're gonna go up the angle here. Sometimes it's a little shocking. You always want to warn your patients too that this is gonna feel and sound kind of crunchy. Really pretty. Straighten that again. I'm going to wipe away my markings, just because I like to be able to really see the angle now that I have created. So that was sort of my outline. Colored within the outline. And now I'll keep going just to add some finishing touches here. tapering dose here, so I'm using a little bit less product than I did in some of the other areas back there. Good. So again, I like to start at the angle. So this is typically where I need the most product. Really just watching on her face, watching the skin to fill till full. Just doing little amounts, low quantity, nice and slow. So we say low and slow here at AAFE. The safest way you can do your injections. And then I'm kind of tapering my dose. So this one here is a little bit less than I started with when I was way back at the anterior part. And as with any of our fillers, they will follow the path of least resistance. So I'm putting my hand underneath here just to make sure that it's not going to sink down. The whole goal is to create a really sharp line here. How's it feeling, Julie? You okay?
Yeah.
That one looked a little pinchier. I'm going to start going up the angle as well. You're doing great. And we're wrapping up here. Crunchiness, I know, it's not fun for the patient. So just, again, have that conversation with them before you start so that the patient knows what to expect. It's totally normal, but it sounds and feels like milk going over Rice Krispies. Okay, again, I like to clean her off just so I can get a good view of everything. And then I'll look at her from all angles and go right, left. Harder right to left, further and further. Straight ahead. Very pretty. This is a patient that has good, strong masseters, I want to point out. Clinch and release. You can see them firing, so relax. Jawline is one of those things that just slimming the masseters can really have a big effect on those. So that's something we've discussed with Julie, is thinking about it. In the meantime, we're just going to sharpen up the skeletal structure, essentially. So we're adding structure, but we're talking about maybe slimming the masseters with Botox in order to get some soft tissue relief. But that is a different look, so that's something she wants to think about. Okay, I'm going to continue to massage and really shape this, but that's about it for that little back mandible area. Okay, we have just finished Julie's jawline here. So when you look at her side to side, she just has a little bit more definition here. Again, her complaint at the beginning of the day was that she wanted that skin pulled back. As you can see, there's really no more skin to pull back. So we have a nice, strong, defined jawline here. Nice snatched back look. Super youthful. It's all the rage and super trendy right now.